Hello everyone, welcome or welcome back to Sowkya Vision. Today we are going to discuss the norma occipitalis of the skull. As in the last class we have completed the discussion of norma verticalis. Today we are going to discuss norma occipitalis. Yes, first of all let's see in the diagram. See, the main bones that are involved in the formation of norma occipitalis are the obviously occipital bone, the posterior part of the occipital bone with the posterior parts of the parietal bones. Yes, these are the posterior parts of the parietal bone and the upper part of the occipital bone forming norma occipitalis. Mainly three bones. What? Two parietal bones and one occipital bone along with the mastoid. This is a mastoid part of the temporal bone. We have one more bone known as temporal bone. This is a mastoid process, mastoid part of the temporal bone. So what are the bones that are involved in the formation of norma occipitalis? A pair of parietal bone that are presented superiorly, and occipital bone, squamous part of the occipital bone that is presented inferiorly. Along with that, mastoid part of the temporal bone are also involved in the formation of norma occipitalis. Yes, when we view from the posterior, when we view from the behind, from backside, it looks convex upward and on either side. It looks convex upward and on either side. It looking convex, right, in the upwards and the either side of the norma. And it is, when it is coming below, it become flattened. When it is below, it is flattened. Now what are the bones? I have said a pair of parietal bone, that is squamous part of the parietal bone, occipital bone inferiorly squamous part, mastoid part of the temporal bone. Yes. Now what are the main sutures that are present? The sagittal suture. What is the sagittal suture? In the last class I've explained what is sagittal suture. It is a suture that is connecting two parietal bones, where two parietal bones fuse from either side in the midline is known as sagittal suture. And lambdoid suture. What is lambdoid suture? Where the pair of parietal bones meeting, connecting with the occipital bone, squamous part of the occipital bone is known as lambdoid suture, right? Now parieto-mastoid suture. What is parieto-mastoid suture? We know this is the parietal bone, right? These two are the parietal bones. From here it is the occipital, this is the parieto, this is the mastoid part of the temporal. Yes, parieto means the suture that connecting parietal bone and the mastoid part of the temporal bone. That suture is known as parieto-mastoid suture. Yes, what is another suture that is present in the norma occipitalis? That is occipito-mastoid suture. Occipito-mastoid suture, that is connecting occipital bone with the mastoid part of the temporal bone. What are the main suture we have discussed here? The sagittal suture, occipital, occipito-mastoid, parieto-mastoid and lambdoid suture. Lambdoid suture is connecting two parietal bones with the occipital, and sagittal suture connecting two parietal bones. Parieto-mastoid suture connecting parietal bone with the mastoid process of the temporal bone, and occipito-mastoid suture is going to connect the occipital bone with the mastoid part of the temporal bone. Yes, there are some other features along with these. What are they? The external protuberance. External protuberance means something that is elevated on the posterior aspect. Yes, these are the nuchal lines. Yes, these are the nuchal lines, are the ridge elevations on the occipital bone. These nuchal lines are three: superior, inferior, and this is present above. Yes, superior nuchal lines are the anatomically represented. Yes, these are the anatomically represented. And along with them, there is also another feature known as mastoid foramen. Mastoid foramen, that is present in the mastoid part of the temporal bone. Yes, this is the diagram of norma occipitalis. Let's see in the. Yes, now what are the bones? As I said, a pair of parietal bone, yes, superiorly, and occipital bone that is present inferiorly, the squamous part of the occipital bone, and mastoid part of the temporal bone. This is the mastoid part of the temporal bone. This green color shaded part is the. So what are the sutures? There are three to four sutures, right? Lambdoid suture connecting parietal bones with the occipital bone. Occipital mastoid connecting occipital with the mastoid part of the temporal. Parieto-mastoid suture connecting parietal with the mastoid bone. And another suture is a sagittal suture, which is very less prominent here. Yes, we cannot appreciate that much as the lambdoid suture, but we can see that suture in the norma verticalis. Yes. Now another feature, some important features are lambda. Yes, what is lambda? Sagittal and lambdoid suture meet, where the sagittal and the lambdoid suture meet. That point, this is the lambda. This part is the lambda. With the point where sagittal suture and the lambdoid suture meet is known as lambda. Now, external occipital protuberance. Yes, external occipital protuberance that is present between the lambda and the foramen magnum. In the base of skull, we have a very big foramen known as foramen magnum, from where the brain continues as a spinal cord. So this is the posterior border of the foramen magnum, and here somewhere we will have here, this is a lambda. Yes, this is a medial line. Yes, the part present as a elevation in between the lambda and the posterior margin of the foramen magnum is known as external protuberance. External occipital protuberance. There is internal occipital protuberance that is presented interior of the skull. Yes. Now, nuchal lines. These are external occipital. These are the lines that are presented at external occipital protuberance on either side. See, this is the external. Let's imagine here is the external occipital protuberance. That the lines that are extending from this protuberance are known as nuchal lines. There are three pairs of nuchal lines, and the last one is inferior, above the which is superior. These are can be easily appreciable on the human skull. Yes. And mastoid foramen. Mastoid foramen is present in the mastoid part of the temporal bone. And external occipital crest. External occipital crest is present between external occipital protuberance and posterior margin of the foramen magnum. Yes, that external occipital protuberance is here, right? And posterior margin of the foramen is present here. Somewhere here we will have the external occipital crest. Yes, this is the complete discussion of the norma occipitalis. If you have any doubt, please comment in the comment section. If you like the video, please do like, subscribe to the channel. Namaste.